And make sure we're unmuted because sometimes I forget to do things like unmute myself. I think we're good. Hello, welcome everyone to another Mental Health Monday. I am so excited for tonight's guest. We have a great conversation lined up for y'all. And if you have any questions that you would like to ask, feel free to pop them into the chat, either on YouTube or on Twitch. I am opening up a queue that is on the Twitch side, but feel free if you're on YouTube to also put your questions straight into the chat and we will get them asked here of our lovely guests. Deborah, thank you so much for agreeing to join us today. I really appreciate you taking the time out of your day.
I am so excited to be here. I am thrilled to chat with you and talk with others. So thank you for inviting me.
Absolutely. So a little bit about Deborah before we dive in. Dr. Deborah Serani is an American psychologist whose clinical specialty is depression. She's an award-winning author of several self-help books on mood disorders, where she writes about understanding depression personally as well as treating it professionally. Dr. Serani is also a professor at Adelphi University in New York and has been a technical advisor for the television show Law and Order Special Victims Unit, which is great. And that is a super cool little factoid. So if anyone's looking to connect with our guest tonight, I have some socials, some links for you. Feel free to click through on any of those. Website, Twitter, Instagram, Facebook, email, all of that stuff. You can find it through any of those links. So thank you guys again for tuning in, and feel free to pop your questions in as we go along. So Deborah, can you tell us a little bit more about your experiences and what made you want to specialize in mental health?
Well, when I was a young girl, I didn't know I was depressed. I apparently was, because at the age of 19, I started to descend into this terrible depression. So bad that I was thinking of taking my own life and made plans for it. Fortunately, my suicide attempt was interrupted and I got immediate help. I reached out to my mom, and the next day I was at a psychologist's office talking about all the things I was struggling with. And I came to discover that I had a clinical illness. I just thought I was struggling with college and things. And this was in the 1980s, where if you weren't home, nobody could call you. There were no answering machines. You were really very isolated and alone. And I was a commuter student in a local college. And I slowly discovered that I was feeling better. And the therapy, of course, changed my life and saved my life. And I said, I need to do this. I want to be a therapist. So I was at my worst moment, got the help I needed, and said, I really want to do this. And so that's how my journey started.
I love that you had this personal crisis, right? And you turned that into not only turning it around for your own life and treating yourself with the grace to get better, but also then you turned it into a career and now you're helping other people. That's so cool. I love that.
Yeah, it felt very natural. It felt very easy. I kind of almost felt like I needed to pay it forward before that expression was even developed.
Yeah.
I just said, wow, this man saved my life. And I really loved the work of it. I loved the tools that were taught. I loved the mechanics behind the mind and understanding all that stuff. So I pursued it in college and
Hmm.
kept going and kept getting more and more training. And so here I am.
Yeah. Did you ever tell that person how much they had impacted you? And
Oh yes. My depression was quite serious, and I was in psychotherapy, psychoanalysis actually, for over 20 years.
Mhm.
And along the way, this man became a very significant person in my life. And yes, I told him often and frequently, and we are colleagues. But yes, he's a major influence. And just, I wouldn't be here without him.
I love that. I think that that's really beautiful. I mean, to be able to not only be impacted by someone to such a degree, but then to be able to thank them and become colleagues with them. That's wonderful.
It really is. It's kind of cool.
Yeah. So, what's your favorite thing about working in the mental health field, and what are some of your biggest challenges right now?
Well, When you're somebody who knows a particular illness or disorder, it definitely does give you an edge when you're working with other people. You don't have to know a particular illness or disorder to be an effective professional, but I do think that it offers so much more when you're working with the person who's really struggling. It's not a common thing for therapists to disclose their own personal experiences,
Mm.
but I'm more of a modern therapist. And if it's treatment productive for a patient I'm working with, I will certainly share with them issues that they may be struggling with because it may help to see, I know what that's like. I remember that. Or if you're bargaining with your side effects of your medication, what do you do with that? And so these moments really become powerful because mental health is a very isolating experience when you struggle with an illness. And it takes so much courage to reach out and get help. And then it takes so much trust to believe in the person you're working with and hope that you're going to slowly get better. And I just have always been outspoken about letting others know that I know what this feels like, particularly if it's a mood disorder or a unipolar depression. That's what I struggle with still to this day.
Mm.
And to answer your second question, Mama, there's so many challenges nowadays with mental health access, insurance coverage, waiting times. It's really bad out there. And, there's a shortage of lots of different kinds of therapists, including psychiatrists. So things are kind of messy. And as a clinician, as I teach as a professor at a graduate school here, I always tell the beginning psychologists to always make room for pro bono work, for low fee work. And, yes, you have to make a living, but you can also make a very good living by making sure that you also help those who don't have access.
Mm-hmm.
So, yeah, that's my spiel. Access is really a tough thing. Wouldn't you agree?
Oh yeah. I mean, we talk all the time about how much of a scam insurance is, to be honest.
Oh my gosh, yes, I call it mangled care. It's not managed care.
Yeah,
It's mangled
mangled care. Oh, I love that. That's so true. Because you shouldn't have such a barrier to have, and it's better, I will say it is better now than it was 10 years ago. It's better now than it was
care.
5 years ago. Okay.
True.
But that doesn't mean that it's the best it could be.
That is so perfectly said. And yeah, and there are many people who are struggling just to make their appointment, just to get the appointment, let
Mhm.
alone navigate the labyrinth maze of what's my deductible? Do I have a deductible? Well, I can't find somebody in network, and you're saying I can't go out of network. And there are lots of tricks and tips as to how to make your insurance company work for you. But who has that ability? Who has that, reservoir of energy when you're struggling with significant issues to say, I
Mhm.
need a supervisor because I know it's against the law to say this and it's against the law to do that, and I have patient rights and yada yada yada. Yeah, it can be very overwhelming, and that's why we need connections like this, podcasts, shows, outreach, because together this is how we shake, big pharma, big insurance, all those things that tower over us because
Mhm.
they can. Doesn't mean that we'll let them.
Yeah. Do you have any one tip for folks if they're struggling to get access? Is there one thing that you're like, most people overlook this?
That's such a good question. I think it really depends on where you live. I
Mm.
tend to like, especially if you cannot get access through your insurance coverage or anything like that, I think universities and colleges tend to be underused.
Hmm.
So one of the tricks I like or techniques I like to say is it doesn't matter now because COVID showed us we can do virtual work. So if you cannot get access to a psychiatrist, a psychologist, social worker, whoever it is that you're looking for, to contact the local universities and ask them what are their resources? Who can they recommend? Because sometimes people who are affiliated with universities understand a little bit more about the need to reach different types of populations and are willing to work at lower rates. So that's always my thing, to reach out to any college or university, ask them, do you have a social work department? Do you have a psychology department? Can I speak to somebody there for some resources? I'm looking for somebody who specializes in eating disorders, depression, bipolar, and I think they're underused.
I never would have thought to call up a local college and ask them for that. That's incredible. I mean,
No, thanks.
yeah,
Well,
I know that they have these resources, right, for students, but I never would have connected, oh, I as an adult who's far past college could still call them. That's great. That's a great tip.
yeah, sometimes when I get a referral for somebody, they'll reach out to me and they'll say, I live in Kansas. And I'm like, Kansas? Oh gosh, I don't know anybody. Give me your town. And I do a search for the local university. I get in touch with the graduate department and I say, I'm a therapist calling from New York. I need some names for a person who's looking for help. So
That's awesome.
I think it's underused.
Yeah.
And a lot of universities have counseling resource outreach. I don't know why they don't promote more, but that would be a good thing for universities to do that.
Yeah, that's really cool. Well, we do have a question in the chat that I want to make sure to get to. This is from Bite Mark, and this is the question that she loves to ask this question. So, what is your favorite poem?
Well, I love poetry. And I love all different kinds of poetry, from really dense Shakespeare to really silly Shel Silverstein. But I will say that one of my most favorites is E. Cumming and the poem of I Carry You in My Heart. It's just a beautiful poem of when you love someone so deeply, child, partner, sister, brother, that I carry you in my heart. You're always in my heart wherever I go. And so that's one of my favorites.
I love that. That's such a good one. And it's a pretty short, I mean, it's not a super long one. So I just put a link to it in the chat. If anybody wants to go read it real quick, feel free.
Oh my gosh, you're so fast.
Yeah. I try to be at least not slow.
You are.
Oh, but that's a great one. And I don't think we've had anyone say that one yet. So that's awesome.
Yeah, I also love E. Cummings because he wrote everything in lower case letters, which is like so totally trendy now, but he was before his time.
Yeah. Yeah, now that's just like, oh, someone was on, Reddit or
Right.
and didn't feel like using the shift key. That's fine.
Yeah.
Oh. Do you have a serial killer or true crime story that fascinates you?
Yes. I don't want to sensationalize things, but it is just so absorbing when you come across human nature in such a degree that it kind of piques your interest. What causes this? I actually teach a psychopathology course, and I've actually written a book called The Ninth Session with an indie publisher, and it's about what would happen if you got a kind of patient that starts revealing things as a therapist that makes you go, oh boy, what do I do with this? I right now we have the Long Island serial killer who's just been arrested. They call him the Gilgo Beach killer. And it's prominent in the news here. It's hard to escape it. So yeah, that is a very fascinating piece. And I kind of don't want to stigmatize the interest in it because I do believe there's a part of all of us that are curious. What causes this? Why does somebody's rage or difficulty yield this kind of behavior? So I totally can understand the interest in psychopathology. I myself, as a professional and academic professor, am fascinated by it. So yeah, and my husband's in the legal field, so we tend to have lots of conversations. He's looking at the law and I'm looking at mind and behavior. So it makes for some good conversations.
Yeah, I think
Do you have anything going on down by you?
I don't think there's anything current. I mean, who knows? There probably is, but I don't know of anything current going on down here. But yeah, I mean, when it comes to true crime and that kind of thing, it is really fascinating to think about the psychology behind what happened and how it happened and how someone got to that point in their life that they're doing these things. And it's so funny because I think in my experience interviewing, especially mental health professionals, sometimes not so much the folks who are sharing their personal journey with mental health, but it's so polarizing. Some people are like, I love listening to true crime. And some people are like, I absolutely don't want to talk about it. Mm-hmm. And it's one of those things that there's that morbid curiosity. And I think it's also partially kind of a how do we cope with the things that we hear about that are going on around us. And sometimes it's digging into the details of what happened and why.
Sure. And, it's just like Halloween is coming up and, the idea of scary things. All of us have endured trauma of some kind. And some of us cope very well with it in spite of the fact, and others may not because of certain vulnerabilities or predispositions. But there does tend to be a certain kind of pattern with really serious rage and anger and repetition of trauma. So as a psychoanalyst, I kind of look at a lot of these crimes coming from a very symbolic point of view, like what's the repetitive trauma this person is playing out. So yes, as much as there's fascination, I can understand how some people are like, no, my life is manageable enough. I don't need to solve any other mysteries or get connected to other stories. But I also understand the pull. I do, very much do.
Yep. And it's fine to be either way about it. You do you. It's all good.
That's right. Just don't, just let's hope that you're not taking notes to enhance your own,
Just like with everything, moderation, it's fine.
Right. No,
if it becomes an obsession, then let's figure that out. So moving a little bit to the topic of tonight, which is all about depression, and both from a patient perspective and a provider perspective. Depression can manifest differently in every person that it occurs in. What are some common symptoms or warning signs of depression that folks should be aware of, and how can they differentiate between, am I just sad, or is this clinical depression?
MommaFoxFire asking the best question. There's 3 areas when it comes to really any mental illness. The first area we look at is physical. Are there any symptoms? The common symptoms for depression, because that's the subject we're talking about, tend to be heaviness, aches and pains, feeling of hollowness, a lot of somatic issues when somebody struggles with depression. The second thing we look at is the cognitive area. People with depression tend to have difficulty focusing, difficulty with memory, difficulty with thinking. Sometimes their thinking's fuzzy or confused or slow, really slow, almost unable to problem solve. And then there are behaviors. We look at certain behavioral issues, tearfulness, sadness, negative thinking. So those 3 areas tend to inform whoever's experiencing it. Okay, I'm hitting all the marks here. But we worry when something like this on a daily basis is existing for 2 weeks or more. Because let's be real, sadness is part of life. Tragedy is part of life. The range of human emotions goes from the extreme despair to the heights of real joy and happiness. But all mental illness particularly has a timeline. We call that pervasiveness. So if you're struggling here and there with depression, a couple of days here, and then you feel better, it comes back again 2 or 3 months later, it's a week or 2, I'm feeling depressed, but it goes away. We would kind of try and look at what's going on in your life situationally. But the worry time is 2 weeks or more. Somebody who's having eating and sleeping problems. And in the DSM, which is what America uses, the ICD-9 for the rest of the world, they talk about that period of time to give us the ability to bounce back from whatever might be going on. But chronicity, time length, and the pervasiveness, how it hits in all aspects of your life, that's when we worry that something is percolating a little bit, maybe more involved than we'd like.
Yeah. So it's the time that it lasts and how much it really affects you. Because you're right. I mean, it's easy to say, "Oh, I'm in a bad mood today," and consider, "Oh, I've been in a bad mood so much lately." But once you really start thinking about how long has it been? Has it been just a couple of days?
Right.
Because
It's very important. Yeah.
yeah.
And there are these great apps that you can download. As I said, I'm a boomer, I'm old, and I'm just fascinated by all this technology. They have ones now that if they listen to you speak, they can tell you as a depressive episode is coming because it listens and marks your breathing and your speech pattern. You can have a mood tracker that starts to let you know if you're maybe having more expansive mood disorder, bipolar pieces. Fantastic. But yes, time is a helper. It really helps. Even some of my patients, the people I work with, who've had significant depressions, who've gotten better, will sometimes say, "Oh, Debbie, I've been depressed this week." And I'll say, "Let's worry if you're depressed 2 weeks from now. You're going through a lot." It's almost as if once you're depressed, you don't realize what might be just a healthy depressive response.
Yeah.
So it's a great question.
Yeah, I appreciate that you can have a healthy depressive response. Like that's something that not a lot of people talk about because just like with other emotions and other reactions, sometimes your body, your mind it's just trying to tell you something.
That's right. That's such a good point. There's things going on currently in the world you can get sad about, and that's appropriate.
Right.
We just don't want that to really push you down into such a despairing space. But you could and come back from it and go, "Oh, okay, I was gone for a couple of days. I just got to try and shake it off." And then we
Right.
don't worry. You're just somebody who's a deep feeler. You're very sensitive.
Yeah. Can you talk a bit about your own journey and some of the key moments or realizations that helped you understand your own depression?
Well, like I said, I was a kid I was always tired. I remember my Uncle Lou, whenever he would come and visit, he'd say, "Hi, Deborah, how are you?" "Hi, Uncle Lou." "Oh, God, I'm tired." And I'd have my bathrobe, this furry little bathrobe that I'd wear. I mean, I was a kid. And he'd be like, "You got to get outside." I'd be like, "Yeah, I know, but I'm so tired." So I didn't know that those were signs of dysthymia, what's now called persistent depressive disorder, a low-grade chronic depression. Didn't know. And once I hit a severe depressive episode, that's called a double depression, and I was really in a bad place, did I come to understand that I had never had ease or a lift in my mood. And when that happened, I couldn't believe this is what you're supposed to be feeling, this ease, this kind of like lightness, like that commercial that peels away with the allergy when it says, Claritin, I think, and your world gets colorful and you're like, "Oh, wow. It was still me, but I was a better me." And it really helped me say that as much as I had a loving family and people who cared about me, they didn't know.
Right.
So even with the best of intentions, sometimes symptoms slip through the cracks until something gets very serious. So my journey was one of a slow healing. And nowadays, treatment is more targeted. There's better medications out there. And I see things now that took decades to fix that can now take months with like genetic testing, finding out what meds work best for you. My God, that's a lifesaver. And it informs me. I understand why people, what they struggle with because I was there. And, just exercise, just go for a walk, eat something. And like, yeah, that doesn't do it.
Right.
I'm not trying hard enough. You have to try harder. Oh, really? I'm going to snap you out of it. Those kinds of things. And even professionals sometimes, I call this lazy medicine. There are a lot of professionals out there that I don't know if they're burnt out, if they're just working too much, or they shouldn't be working with people who have emotional and mental health issues. They will gaslight their patients and say,
Mm,
well, you need to do this more. You're not doing that. Instead of helping to understand what the patient is feeling.
mhm.
So that's that duality that I'm not, I don't want to say I'm proud to have it. I feel privileged to know both these sides. And to take on some of my colleagues when there's ridiculous behavior going on or
Right.
things that I don't like seeing I'm always writing a letter somewhere to some newspaper about some article
Yeah.
or some way something was portrayed in the media, which is why I liked working for Law and Order.
Mhm.
It was a great experience to, in my own way, change the dialogue and help diffuse stigma.
Yeah, so I want to talk about that also. You worked on shows like Law and Order SVU. That's really freaking cool. First of all, like, how did you get started with that? How did you get involved with that?
Well, everybody who's a technical advisor always knows a writer. So one of my friends who was writing for the show started to say to me, "Hey, Debbie, can you help me with some of this dialogue?" And I'd be like, "Yeah, sure." So he had just gotten a job and sent me the script. He's in California. I'm here in New York. And I would say, "Oh no, therapists would never say this. Oh no, oh God, you cannot say this. And this is unrealistic. This would never happen." And we started doing that more and more. And he won some awards for mental health advocacy. And I like to think that, I had a little hand in that. But it really was a shockingly eye-opening way to see how sensationalism wants that crazy psycho stigma.
Mhm.
And I said that there's a way to really tell a great story, but in a truthful way that doesn't stigmatize mental illness. And I feel super proud of that. And they named a character after me. I'm a judge, the Honorable D. Serani.
Oh,
So it's
that's
a
so
recurring character.
cool.
So every now and again I see it. I'm like, oh, there I am.
That's really neat. That's really cool. So, do you also, in your role as a professor, you said you teach us psychocriminality? What was it?
Psychopathology. I teach a course on
Psychopathology. That's what it was.
psychopathology. So, in talking about why certain illnesses occur and why real minor mental illnesses,
Hmm.
severe mental illnesses, and certain, criminal behavior. So I run the range in explaining that. And there's always one thing in common. It's genetics and trauma. Not that trauma causes the genetics or the genetics cause the trauma, but there's usually some significant story that helps explain why some of us struggle with unipolar disorder, bipolar disorder, schizoaffective disorder, and others don't. Even twins.
Hmm.
There's fascinating studies on, why does this happen? We really don't know everything, but we know enough that it's certainly not being lazy or willful or crazy. And we can't snap out of it and make your beautiful eyes, your blue eyes brown just by willing it. It's an illness, and we wouldn't shame anybody with cancer or
Hmm.
leukemia, but we do that with mental illness, and it just makes me I have to do something about it.
Yeah. Well, it's great that you're in these positions where you're able to bring awareness and have that influence over portraying what other people are facing in the media, because that to me is one of the biggest things that helps people, and that helps me is when I see someone portrayed accurately
Yep.
who is like me on a screen.
Yes.
It's so
Yes.
neat to have that. So thank you
Yes.
for doing that.
Well, I that was such a fluke and a lucky experience for me. And to go on that line of thinking a little further, Mama, when a celebrity comes out and talks about I have postpartum, or I think it was Adam Duritz from Counting Crows, he talked about having depersonalization disorder, which is a very rare disorder. And I was like, this is just so great because somewhere, somebody out there is going to say, okay, he's gotten through it, and, maybe if I can get help, or I'm not alone and there's somebody out there. I think we need to know that this is just as significant as any medical illness, and there's no shame.
Mm-hmm.
Still is. So we got to work at it, which is what you do too.
Yeah, absolutely. There's a great show. Oh, and I wish I could remember the name of it. Maybe it's just called The Maid or Maid or...
Well, Maids?
Maids? Is that it? Well, so it's about basically like just the one maid.
Oh, I don't think I know this. Okay.
Okay, so let me, I'll find it real quick on Real Good because it's such a good show, and it's about this woman who's in an abusive relationship and kind of the struggles that she goes through, and just seeing her struggle, oh, here it is. It's just called Maid. And I'll send you a link. I'll put a link in the chat.
I'd love to, yeah.
And then I'll also
send
I'll send you a link on our Discord chat here
Thank
too,
you.
because it's such a good one. And seeing that relationship portrayed and some of the choices that she's forced to make while she's trying to exit this relationship, it was so nice because I watched it when I was already on the back end. I had already filed for divorce. I had already separated from my ex. So I had already been through everything that I was going to go through for the most part. I mean, I still have to co-parent with the guy, but whatever. So, but it was so refreshing, dark story, but it was so refreshing to see how she was making these decisions and how she was handling it. And I know there had to be somebody like you on the other end of that writing saying, that's not how that would go. Let me tell you how this would happen if I were in this show and this was my life experience. This is how that would probably happen. It was really neat.
I mean, the power of story, the power of narrative, be it fiction, true, or inspired by true events, has the power to heal, has the power to educate. And there's a responsibility that needs to come with that. And some people really are all behind that. And then there are others that, you still see these crazy things, like just around now, like Halloween time. My big thing is, mental health isn't scary, but ghosts and goblins are, So, but yeah, there's still this pull that, there's something invisibly frightening about somebody who could just go and snap at any time, even though statistics show that people who struggle with mental health are more likely to be the one receiving hostility or violence. Yeah,
that's something a lot of people don't understand quite yet. I'm hopeful, but quite yet is that you really are a little bit more open to being on the victim side than on the perpetrator side.
But I do want to say, Mama, if I could, there is a very small percentage, but it's so small, like we see in the news, individuals that slip through cracks and get to certain kinds of firearms or activities that, yes, that is true, but that is so singularly the minority, not the majority of most individuals who struggle with mental illness.
Yeah.
But yes, there are people who like to stoke that fire.
Right. Well, because
yes, but didn't you just see what happened in Maine? Oh, yes, I did. I know.
Yeah, exactly. The thing is, we don't hear about the vast majority, right? We only hear about that one little piece.
Sensational, my
That's
gosh.
right.
if it bleeds, it leads. I wrote a paper on, the fact that that's what news media does. What's in your water? Tune in at 11. You gotta, what is in my water? Gotta tune in at 11. But, there was I don't know if it's still online, but the Good News Network was trying to fight. And I would go and visit it and there'd be all this good news and it was fun and, but nobody likes good news. You want that, oh, thank God it's not me feeling, or this happened where? Unusual, but that's part of human nature.
Yeah. Was the Good News Network the one that Ryan Reynolds started during COVID? Is that the same one?
No, wasn't that Olivia Wilde, the Ted Lasso guy? I
Oh,
don't
I
think it
don't
was Ryan
know.
Reynolds, but yes, his child would write like a Good News Network. I think they kind of created their own little
Yeah. Okay.
podcast or
Okay.
website. But no, there was a whole website called the Good News Network.
Oh, that's great. That's
Yeah.
really cool. Many people find it challenging to recognize and accept that they might be dealing with depression. On the one side, it's like, I don't know if I have depression. How would I know if it's just sadness? On the other side, it's like, not me. I can't have depression. What advice can you offer to those who suspect they might be depressed but are super hesitant to actually seek help?
Another great question. The individuals that call and reach out, go to their PCP or, say, I'm not feeling good. Big, brave step.
Mm.
But you're right. There are almost as many, if not more, individuals who tamp it down, push it away. It may not present as sadness and heavy despair. It may present as irritable, angry, impatient, short tempered. And it's hard for them to see that those are symptoms of depression too. So I don't know what you're talking about.
Right.
Loved ones have to be patient because those are the individuals that are the last ones to, get their butt, in a place to get the help that they need. But that doesn't mean that loved ones, friends, colleagues, family can just occasionally, I'm worried about you, I'm concerned about you, how are you feeling? Would you consider, how about this? And they shut you down. Okay, all right. And then you try again. If there is ever a time somebody is struggling and they are not doing anything to get help, and I know it's really not controversial, it's really a very important thing. You can always call the local police and tell them that, no sirens, no lights. I'm concerned about my family member. I would like to have some help taking them to the emergency room. And I've done this here many times, even in this office, had individuals that would not go when they were in really bad place. And the interesting thing is that once the episode is done and they're feeling better, they're not mad. They say thank you.
Mm-hmm.
But they're mad during.
Oh, I'm sure.
They're mad during. So, in short, try to help and be supportive and, take the stigma away. Leave little notes, little papers, little research, send a text, have you read this? But also recognize that that's a process. That's a grieving process for some people to come to terms with their diagnosis. It's not just, oh, I'm depressed or, oh, I have bipolar disorder. There's an enormous trauma of, I don't want this and I have to deal with it.
Mm-hmm. Yeah. For someone who is currently experiencing depression, what are some practical steps they can take to start their healing and reach out to a professional for help and support? What are kind of those first steps to get from where they are today?
Well, one of the first things I always like to tell people is if you're not feeling good, go to your doctor, go to your physician, and share with your physician some of your symptoms, because there are some symptoms that could look like depression, but aren't. You can be anemic and things like that. You can have a slow thyroid and it can make you feel tired and sad and sluggish. And then if everything comes back okay, you ask for a referral from that particular person or you do a search on your own. You always need to feel safe with your therapist. I don't care if I like my hand surgeon, if he's a good hand surgeon. I don't care if I like my hairdresser as long as she cuts my hair nicely, all those kinds of things. But you have to feel a sense of safety and space. And my advice to somebody reaching out is you can call as many people as you need to, and you'll know when you speak to that person on the phone. You'll just get that sense over the phone. And other things you can do while you're doing your own treatment is read about depression, empower yourself, believe that this is an illness that is treatable. And the one word I always tell people, consistency. It's so important in any mental illness. Do your treatment goals. If you're taking medication, take it as prescribed. Make sure you self-care. set boundaries, say no. All those things you'll learn with your therapist. But the most important thing to me, living with depression, is I have to self-care. It has to be a priority. Otherwise, I'm good to nobody.
What are some things that you do for self-care?
Well, before I came here, because I'm a little later than you, I was taking a nap with my fiber optic lamp and my lava lamp. I have an extra guest room where it's just, I have nice music playing, little stars. That's my little sanctuary. So
That's
I
really cool.
self-care every day. I used to take a cat nap with my cat. But I'm very big on feeding my senses, holding a glass of tea and really feeling the heat, savoring it when I sip it, really appreciating things I see, because I do feel grateful that I'm still here because I was almost not here. But self-care is, to me, about feeding your senses, making sure you take time every day to just do that, which can be hard for some people. But I'm really good. In fact, my husband has learned, he'll say, Debbie, can we go out with the Smiths? And I'll be like, well, it depends what time. He says, well, they want to go to dinner at 8:30. Yeah, no, that's no good. We have to eat at 6. What are you talking about? That's what I need. 6 o'clock. I'm asleep by 9. So, advocacy is really important because it's invisible. You see somebody with a broken leg, we'll hold the door open. What do you need? Oh my gosh, yeah, let me make sure that everything's comfortable for you. But, mental illness, there is no sign
Right.
or, alert that makes somebody be a little more human and kind. So sometimes we have to really fight for that respect and for those boundaries to say, I need to take care of me. Like the airplane mask, you got to breathe it first before you put it on your own kid.
That was something that my therapist really stressed with me very early on when I first started seeing her. And I'll say also, going back to kind of first steps, and you were talking about, and then I'll come back to this, I promise. And then so you were talking about, call as many people as you need. And I had an awful experience with my first therapist. So if you're not having a good experience with a therapist, call someone else. They're working for you. You can fire them.
They're working for you. Fire them.
Yes.
You don't even have to fire them. Just say nothing and don't come back.
Absolutely.
If it's too hard. Absolutely.
Yeah. Yep. And so then the other thing that the therapist that I wound up absolutely adoring, I'm so glad that I gave therapy another try several years later because it was totally worth it. But that's something that she stressed with me was that I had to make time. She was like, if you, and I'm a big gold star, give me a checklist, I'm going to get it done kind of person. She was like, if you come back to me next week and you haven't done X, Y, and Z, you're not going to get a gold star. So she kind of put that threat. Yeah, she gave me a little bit of a threat, but it was a soft threat. Yeah. And at the time, it wasn't always safe, quite frankly, for me to prioritize myself. And so it was something that she was like, yeah, but it's not safe for you not to either. So it's so critical. And some people just kind of brush it off like, whatever. But it's really important.
And it is hard because sometimes we're groomed or we're raised in a particular way that we're not supposed to complain or we're supposed to just keep going and doing. But any illness, if we said to somebody who has Parkinson's or cancer, you got to really take care of yourself and go slow. And it's okay if you don't get everything done on your checklist. And, it's the same thing for individuals who struggle with mental illness. It's a physical, neurobiological experience. It's not a psyche thinking, crazy kind of stigma that people think that we just can't get it together. We can. We've got invisible things you can't see.
Yeah.
But yeah, self-care, I would say a good deal of the work that I do with the people in this office is at least 50% self-care. Helping them set up boundaries, helping them advocate for themselves, to carve out a life that's meaningful in spite of the fact that they may have depression or anxiety or OCD. We don't want it to define us. or limit us.
Yeah. Yeah, that's really great. What are some of the, so self-care is one, obviously, but what are some of the other most effective strategies or evidence-based therapies or interventions for managing and recovering from depression that you recommend to your clients?
Well, again, everybody's depression is going to be very different. And I have had the luxury of really learning and practicing lots of different approaches because of my affiliation with the university, which I'm very privileged and feel so lucky to have, because I see value in all different types of interventions. So one of the first things evidence-based really talks about is cognitive behavioral therapy, changing how you think. Depressed individuals tend to have very negative thinking, catastrophic thinking. This doesn't matter. I'm never going to get this fixed. I'm never going to feel better. There's this very narrow focus of thinking. And if you go step by step, thought by thought, and switch it to a positive one, fMRI research shows that different parts of the brain start working. The frontal lobe of the brain starts to light up more, which doesn't function well with depression. So positive statement, reframing, we call this cognitive reframing, very important. And it's hard. It's very hard because it's a habit, the way some depressed individuals think. We call it a learned helplessness. So that's something you can do even without going to therapy. Great journals online. You can just start your own, like, what am I thinking? And you write 5 things you're thinking and go, oh my God, how do I make these positive? How do I find the silver lining? Not in a Pollyanna kind of way, but in a really constructive way to say, if you are what you think, that's what some of the neuroscience shows us. We are what we think. Another form of therapy, which is what I use, is insight-oriented therapy or psychodynamic, where we take some of the deeper layers of your sadness and try and trace them to unfinished things in life or traumas that have happened in a way to heal them so they don't kind of come with us. That's like the luggage. And then, of course, there's medication, which to me, I'm a talk therapist. That's my last intervention. It's not my first intervention. But nowadays, I mentioned you can do genetic testing, a cheek swab, covered by insurance. Don't let anybody tell you it's not. And if your insurance doesn't cover it, it's $349. They'll even give a payment plan for you. And in 10 days to a week, you come back with genetic markers of what meds work for you.
That's really cool.
Yeah. I had a someone who started coming to me, and we went to her PCP, long story short, gave her Prozac. Prozac's the most common antidepressant. And I'm like, she really won't give you the genetic test? No, she doesn't know anything about it. I'm like, all right, so we'll stick with Prozac. Not getting better, not getting better, not getting better, actually getting headaches, not feeling good, having really bad physical aches and pains. And I say, that's it, you got to come off this. So she slowly comes off. We find another doctor to do the genetic test. Guess what comes back as the worst medicine for her?
Got to be Prozac.
That's a go-to. In fact, all of the go-tos, Lexapro, Cymbalta, Zoloft, all bad for her.
Wow.
So, yeah. To me, it's a no-brainer. Like when a baby's born, handprints, footprints, little cheek swab, because what antibiotics work, what formulas work. It's an amazing science. I know some people can get scared of it. Like my husband's like, I'm not letting anybody know what my genetics are. I'm like, you're an old fart. But I took it, and I'm on Prozac. And it came back, and Prozac is my number one. And I knew it because I had felt better within 6 weeks of taking it.
Yeah. That's really cool. I mean, just that they can tell that from something as simple as a cheek swab. You think of genetic testing, and it can sound really scary. It's like, oh, you're giving someone your data, but
right.
at the same time, think of everything that you're getting back.
Yeah, and if you like, I can send links to you, and maybe you can put them up for other listeners
That'd be great.
because, it really is a life-changing thing, and a lot of doctors don't know about it or are misinformed about it because they'll say, "Well, it tells you what medicine, may work for you. It doesn't mean it will." And I'm like, What does that mean? What are you talking about? It says these are bad.
Right.
These are good. Yeah, well, it won't cure depression. Not saying it will.
Right.
Oh my God, I can talk for hours on other medical professionals. Anyway.
Well, I mean, if it's going to have a bigger impact on you, if it has a better chance to help, why wouldn't you try that? Like I'm allergic to a very common antibiotic. I can't have it. And so
How did you discover that?
well, when I was a kid, they gave it to me. And I broke out into hives, and I haven't had it since then. And because it's a derivative of penicillin, I also don't have penicillin-based things. And so it's like, if you know that, if you could have known that ahead of time,
Right.
then I wouldn't have had that. And of course, I don't remember having hives. I don't remember having the reaction.
Right.
But my mom remembers.
Listen, they said that genetic testing can save 10 years for people who have treatment-resistant depression because a first-line medication, you start at a low dose for a month, then you go up to a higher dose. So that's 2 months. Maybe you go to even higher dose because it's not right there. That's 3 months. Not feeling better. Another month, a couple of weeks to come off. Let's start a new one. 1 month at the low dose, 2 months at the, before you know it, it's a year.
Yeah.
And then another year goes by to try a third medication and a fourth medication. Big Pharma doesn't want us to know about this. The medical associations, some of them get kickbacks for the prescriptions they write. I hate mangled care. I hate it.
Insurance is a scam. It has screwed up our system so much.
It's not healing. It's not helpful.
No.
It's capitalistic. And again, another letter I'll write to somebody. But I talk about this a lot, and I fight as much as I can for people because there's another issue is that if you have to stay in network with your insurance company and you cannot find a therapist, keep a list of every therapist you call. 10 to 15 therapists. Then you call the insurance company when you find a therapist that's out of network and you say, I found somebody. You have to pay this. You have to pay them because that's the law. People don't know that.
I didn't know that. That's incredible.
There's, I can't remember who it is, if it's Linda Pino, P-E-E-N-O. I don't think she's the author of the book, but this was a book written by a doctor who was working for managed care. Somebody died on her watch, so to speak, and she said, I can't do this. So she wrote a book talking about all of the bad things they do. I love this book. I can't remember the name of it. I love it that much, though. But yeah, I mean, it pays people who are struggling and ill. The insurance companies want us to be overwhelmed. And that's why, whenever we can find ways to circumvent it, it's not only good for the patient, but it's a comeuppance for those in power because it's terrible. We didn't have managed care 30 years ago. You went to the doctor, you got what you needed.
Yeah, it's just gotten worse. Look,
I don't want to make this, visit a bummer.
So apparently there's a documentary type movie about Linda Pino called Damaged Care.
Yeah. Oh, yeah. And there's also the movie Sicko by Michael Moore. He was following managed care and how terrible managed care was. He actually, it's not funny. I find him brilliant in some ways. He actually went to an insurance company with caskets and had people stand in the caskets because they weren't granting certain tests and treatments for particular patients. So he said, let's just go and film there.
Oh, wow.
I love that.
Yeah.
Sign me up. Let's go.
Yeah,
Yeah.
that's powerful. And I know that the other, because Michael Moore's done a lot of different documentaries and stuff, and he always has some of the most powerful metaphors,
Yeah.
the most powerful demonstrations.
I mean, I think he's pretty brave and maybe should be a little bit more careful, but I do remember watching Sicko and going, oh my God, that's brilliant. It was brilliant.
Yeah.
Bring the coffins right to the front of the office of the insurance company that wasn't going to pay for these person's treatment.
Yep. That's great. Well, beyond
And
insurance being completely shitty, the stigma around mental health can sometimes also deter people from seeking treatment. So, how do
yeah.
you address and reduce stigma in your clinical practice? And then, what can other mental health professionals do to create a more open and understanding environment for their clients?
Another great question, Mama. I believe that mental illness affects 1 out of every 6 people. So this is an everybody issue. And the more we embrace, like, not that I'm a celebrity fan, but I do always note when somebody comes out and talks about this, that, or the other, that it's a great piece. I remember when Bruce Springsteen came out talking about his terrible, terrible depression, and that he was getting psychotherapy. Shortly after that, I got a lot of male referrals, like young guy referrals calling.
That's
And I was like,
great.
yeah, I wonder if that's kind of like a roll off of that information. We need better policy. We need to educate. Oh my goodness, people in power, our legislators. We need to have much more grassroots movements and doing it in ways that puts us in a light that's respectful and professional, and to acknowledge when things like certain shootings and other things, yes, that we say, yes, this is a mental health issue and it is a gun control issue. And, for myself, I do a lot of local outreach, and to make things feel safer. And that's why I talk openly about knowing depression from both sides. I don't know why others don't. Maybe they do, because there's this ethical thing that you're not supposed to really use the session for yourself. I'm not using it for myself. I use it and disclose when it's appropriate for the patient to know.
Yeah.
And it helps to take away that stigma. But yeah, we need to do a lot more, and it certainly hasn't been easy.
Yeah. I hope that it gets easier soon. The more and more people that talk about it, the more and more people that are open.
That's so true. Yeah, it's very true.
be.
And, organizations like NAMI and grassroots movements started because people were just tired of being, shut out or discriminated against. And I do believe very strongly that the medical field needs more education from trained clinicians that understand mental illness, because there's times when I write down the medications I take, I am not treated well. And there are times that I don't put it down to purposely see what the story is, and I'm treated better. That's called medical gaslighting, diagnostic overshadowing. And there are many of us who will say, yeah, that's why I won't go to the doctor. That's why I don't trust this one, because you're treated so poorly. I had a pharmacist say to me, oh, I called for my prescription. Oh, right, there's a full moon out. You got to get your meds. I'm like,
what the hell?
what did you say? Oh, I'm sorry. I thought it was funny. That's not funny.
No.
That is not funny.
Wow.
That's inappropriate and unprofessional in front of the Target, the Target pharmacy.
Wow.
You think that's funny?
That's so disheartening.
For?
Yeah. Yeah. I like I said earlier, I didn't go. I thought therapy just was really shitty because of the experience that I had at first, and I didn't go. I stopped going and I didn't go for like a year and a half after that. And
That
I'm glad that I gave it another try because it wound up being great, but
it
yeah,
is
it was a
common.
bad
I mean,
experience.
bad therapy happens, and this is another conversation that's difficult. There's lots of different levels of training,
Hmm.
and sometimes with mangled care, the professionals that have the most training will say, I'm not, you can't pay me this fee. This is a 1970 fee. I can't
Hmm.
live on this. I've got malpractice. I've got this and all of that. I can't, this will become $10 by the time I'm done after
Yeah.
taxes and all that stuff. So it's a significant issue. I hope it gets better. I don't see things changing the way I'd like them to go, but I'm glad that you gave it another try because it does matter.
Hmm.
If you're not feeling safe with your therapist, if you're not feeling heard, if you leave the therapy session, they're answering their phone and they're having, hold on a second no, I don't pick up my phone. Everything's off. You're with me for 45, 50 minutes.
Hmm.
This is it. Um, so there is bad therapy out there.
Yeah.
And to trust your instincts. And that goes for anything, bad plumber, bad hairdresser, trust that gut, they're working for you.
Yeah.
And don't be afraid to say to your therapist, I'd like to revisit what we're doing because I'm kind of feeling, I'd like to be a little bit further along, or I sometimes I build that into my sessions and I'll say, so how are things going? What could I do more of? What could I do less of? It's there's an art to it
Hmm.
as well as a technical piece, but you're the boss.
Yeah. You gotta do that performance review as the boss. You gotta do that performance review with your therapist.
Yeah, it's very important.
Yeah.
Yeah.
How can someone who doesn't have depression or has never experienced depression be a supportive friend or family member to someone who does?
Another great question, Mama. I love this expression. You're going to be there for your friend or family, but you're going to listen. You're going to listen to understand. You're not going to listen to respond.
Mm.
The word listen has the same letters as the word silent. People who are depressed don't want to be lectured to. They really need to be heard or held in what we call a holding environment where they feel safe. Tell me what I can do for you. Is there anything I can do to help you feel better? Most of the time, people will say, I don't know, or it doesn't matter. And that's when you say, well, tell me what you're thinking and going through. Help me understand. Do you want me to just sit here with you? That comfort of just willing to not fix, because that's what a lot of loved ones want to do. They're either coming from, come on, snap out of it, this is not real,
Hmm.
to what can I do? Can I cook you a meal? How about we go for a walk? Or you know what, let's do this. And the depressed individual will say, at least from my perspective, it was just be with me.
Hmm.
Watch TV with me. Let's not talk about anything. Just be with me and make me feel safe. So listening with the intent to really understand is a goal, not to fix, not to criticize, not to, yeah, but, and again, if you're really worried about your loved one and they're really in a very bad place, why don't we let's go to the emergency room, make sure you're okay. Sometimes they'll say, okay. Sometimes they'll say, no, what are you doing? But hearing that will sometimes help them say, oh, he gets it or she gets it, or they
Hmm.
understand. And there is always help. You can always get help. But that's what most individuals struggling with a mental illness will say is, I just want somebody to just be with me and just, they don't have to understand or accept it, but try not to fix me. I just need you here.
Mm-hmm. I like what you said about the same letters being in listen and silent, because it's so easy to listen to someone and to immediately start just thinking about things that you need to say, instead of saying,
Right,
I'm going to hear you all the way out, and then we can talk after that. But I'm going to really take the
right,
time and zip my lip and zip my
right.
brain
Well,
and just take
I
it
actually,
in.
yeah, I don't want to take credit for it because I saw it somewhere. I saw it in a sign. It said, listen has the same words as silent. That's all it said. And I
Yeah.
went, yeah, it does. It does. That's so great.
Yeah,
So
that's really cool.
I borrowed it.
Yeah.
But
I
it's
like that.
true. And it's a really easy thing to help others. You say, listen, but be silent. You don't have to worry because they have the same letters.
Hmm. I think also just asking about it. One of the things that I talked about with one of my guests last week when I was talking to Scott Graham, the way that he phrases things was so great, because he says, how's the depression today? And
Yes,
calling it out like that, I think for me, if someone were to come up to me and say, how's the depression today? That's a different question from how are you?
that's so true. That's such an excellent point. Yes. And it takes the um, fear away of talking about it or the
Yes.
invisible elephant of it. Yeah. Yeah. Oh, I'm borrowing that. That's
Oh yeah,
good.
absolutely. Yes. I mean,
That's
he
really good.
he shared it, and it was in the context of grief, also talking about
Mm,
how's the grief today,
mm.
and it was really powerful conversation. But I love the phrasing of, and he,
Yeah, I do too.
yeah, he kind of emphasized also, instead of saying how's your depression, how's the depression, how's your grief, how's the grief, to
Right.
separate it
Because it,
from the person
that's right.
also.
It becomes an experience, not necessarily the experience that defines you, I guess. I
Exactly. Yeah.
really am running with that one.
Go, absolutely, go for it.
I'm out in the street. I'm
Yep.
ready for that.
Are there any resources or exercises or anything like that that you feel that someone who has experienced depression or is experiencing depression still could benefit from?
There are some very simple things one can do, and they involve, again, senses. If you're depressed, please open the shades, bring natural light into your space. It is an enormously quick, healing, pineal gland, helpful physiological change. Really important. Another thing is breathing. People tend to breathe from the mouth when there's extreme despair. If you can shift it by breathing through your nose, it can invigorate maybe whatever activity you do have in reserve to kind of get you going a little bit more. Um, Eating. I know it's so good to have those carbs. It feels so good, but there's a fallout from it. So if you're depressed, try to eat more lean protein. I keep little protein bars, hard-boiled eggs, something easy, a slice of cheese, just to help keep my blood sugar at a level that's good. Um, and anything else that can soothe you, real soothing. Weighted blankets, a warm shower, cup of tea. I can understand if you want a glass of wine, try to refrain from that. I could certainly understand if somebody's pulling for, different substances because it helps perk them up.
Mm,
Try not to. Um, but really, again, the simple things are all related to your senses. But light is the most wonderful and easy thing. Open the window, get some fresh air, get some type of sensorial shift going.
mm,
And that can maybe give you just a little reserved energy to maybe make that call, or maybe get out of the house, or maybe call your friend, maybe say, I'm going to see a therapist. It's that fatigue. I'll never forget it. I still have vivid memories of how am I going to turn from my back over to the other side? I can't do it. I'm just so empty and I couldn't do it. Terrible.
Yeah. I feel like, especially right now, because we're going into winter and everything, and it's great to get some of the light. If you're like me and you sit at your desk all day because you have a day job, my coworkers all know my habits in general, and so I'll be like, look, we're gonna end this meeting 5 minutes early because I've got to walk out of this room for a little bit. I can't do it anymore. I gotta walk out. And so it's one of those things that really does help you if you're especially in a stressful situation or something like that where you've just been doing the same thing over and over in a day.
Yes.
And it's hard to put that boundary in place and say, I need 5 minutes. And then to force yourself to actually, instead of continuing, oh, I've got one more email to answer, or I've got one more this to do, or I don't want to stand up off of this chair or whatever. It's hard. It's hard to do that. But if you can, just stepping into another room, and I step into my living room's right there, and I look out, my backyard has a beautiful, beautiful tree in it. And I look out my backyard at my pretty tree. And, it's one of those things that it's just really a lot more helpful than you realize maybe in the moment.
Right. It's that shift, just like some type of shift that can, move your chemistry or your perspective in a little bit of a different way. Yeah.
Absolutely. Merck says, I love all these little tips and tricks we pick up. And I agree. There's always something. I always learn something from doing these interviews. It's wonderful.
Me too. I do too. And I learn from every interview I do because there's always, this back and forth and give and take. And I just love the grief, the depression.
Yeah.
Really good.
Yeah, it's great. Well, we are at our magic moment of the stream. So let me get my magic wand. I happen to have this magic wand and it lights up and everything. If you could wave a magic wand and eliminate one common opinion or misconception or theory surrounding mental illness, disabilities, or talking about mental health, what would you eliminate?
I would want to eliminate that mental illness is a matter of will. And if you try hard enough, you can just snap out of it. I hate that.
Amen.
It's my pet peeve. It's my pet peeve. As someone who knows it and someone who treats it, I know from both ends, it is so untrue.
Yeah.
Wave those wands. Let's get rid of that.
Yeah, right? Everybody get your wand out and wave it. Maybe our collective power can just eliminate that lickety split. That'd be great. Yeah, because it's really not. It's not a matter of, I can think myself out of the depression, or I can just decide that I'm not going to be depressed anymore. That's not how it works. I can't decide not to have a broken arm.
You can't give it the slip.
Yep.
You can't deny it, give it the slip, minimize it, say, well, maybe. No, it finds you.
Yeah.
It does.
Yeah, you can't just decide. It's true. Well, I'm going to open up any remaining community questions. Folks who are here in the chat, if you have any questions that you want to ask our guest tonight, feel free to pop them in and Deborah and I can address them. And Deborah, I'll just open it to you as well and say if there's anything we didn't talk about or any resources or websites or anything like that you want to throw out there, feel free to just take the floor for a minute.
Remember, we were going to do a book giveaway.
Yes.
This is my second edition of my award-winning book, Living with Depression. It's kind of sort of memoir self-help book. And Mama and we're going to have a raffle copter giveaway, and I'll sign it to the winner and send it on out. I would love for listeners to kind of maybe check it out, or can get it at the library. I as much as I write books, I do love libraries because you get it for free.
True. That is true. Yeah. So if you're here, make sure that you follow Deborah on Twitter or X or whatever it's called today, and follow me as well, because we'll both post about it. and make sure that we get that link out there so you can enter the giveaway for this book, because it's a really cool thing that you're offering, and I appreciate you just offering to do that. That's wonderful.
I'm thrilled to do that. I'm thrilled to do a giveaway. Yeah.
If you get it at the library, remember not to reshelve it. What does that mean? I don't understand what that means. That's always difficult. What does it mean to not reshelve it? She's typing, I'm sure. Well, Bite Mark said, I just want to say thank you so much for being here. And I agree, Deborah. Thank you so much for taking the time today.
Oh my gosh,
it's been
thank
beautiful.
you for this invitation, Mama. I am so happy to have been here and visited with you and get a chance to talk about all these important things.
Yeah, absolutely. Oh, okay. Libraries track usage by when they have to reshelve books. So if you reshelf it yourself, then if you read a book and want them to keep it and get more of that kind of book, don't put it back where you got it. Always just drop it in their Dropbox.
Look at this.
I didn't know that either.
Another thing learned.
We need one of those.
Thank you to whoever shared
stars.
that.
Yeah, you need one of those stars going across that says the more you know.
my brain is just so much bigger now.
Absolutely.
I'm really thrilled to know that.
Yeah, that's really cool. I did not realize that either. And I used to work for a firm that was one of the premier library design firms, and I didn't know that.
Just goes to show you.
Yeah, it does. Well, thank you, Deborah, so much for being here. I appreciate you taking out the time and joining us here. This has been a lovely conversation.
Yes, thank you again so very much.
All right, chat, stick around for just a minute. I'm going to disconnect with Deborah, and I will be right back. Hold on a minute. That was such a lovely conversation. I hope that y'all enjoyed that. Deborah was such a good, thorough guest. That was wonderful. Okay, we're going to say goodbye to YouTube. Bye, YouTube. Hold on. Let me actually get where we can say goodbye to YouTube, and I'll switch to some sort of game. I'm not sure what game yet, but I'll switch over to it. And thanks for being here, folks on YouTube. I appreciate you taking the time out of your day and joining us. So we'll catch you next time.